In Los Angeles County, food insecurity surged during the initial months of the COVID-19 pandemic, with 34% of households at all income levels experiencing food insecurity in 2020. When additional COVID-19 relief resources devoted to emergency food access ended, food insecurity worsened during 2022 and 2023. The research suggests that this post-pandemic increase in food insecurity may be due to inflation and higher food prices, and to the after effects of a pandemic-era boost to the Supplemental Nutrition Assistance Program, or SNAP, benefits that ended in spring of 2023. Signed into law by President Biden in March 2021, the American Rescue Plan Act, or ARP, provided Los Angeles County with $1.9 billion to build an equitable recovery from the devastating effects of COVID-19. The Los Angeles County Department of Public Health, or DPH, was allocated $15 million of this funding to implement a grocery voucher program to reach communities affected by the pandemic. From March to December 2023, DPH implemented the Los Angeles County Grocery Voucher Program to address food and nutrition insecurity among populations that were not eligible for other food safety net programs like SNAP. The Grocery Voucher Program helped households living in low-income communities by providing cash value benefits to help purchase food for the participants and their families, particularly immigrant communities and opportunity youth, who are young people between the ages of 16 to 24 and are disconnected from school and work. Participants of the program were given the option of receiving either a grocery gift card for in-store shopping or an online purchasing and delivery option. Participants received an average monthly benefit of $100 to $150 per household, depending on the household size, for 6 months. The grocery stores that participated in this program included local retailers, and DPH partnered with community-based organizations that serve immigrant and/or opportunity youth. These partners conducted outreach, promotion, and enrollment activities with an eye towards reaching communities of color and other underserved populations. To ensure the equitable distribution of program benefits, DPH used LA County's Equity Explorer online mapping tool. The tool included the COVID-19 Vulnerability and Recovery Index, which was intended to guide ARP spending by prioritizing activities geographically according to area need tiers. DPH also utilized this tool to identify historically marginalized populations, such as immigrants and opportunity youth, and applied a layer on limited English proficiency and concentrated disadvantage to focus benefits on communities most in need. Not surprisingly, the same households in certain low-income communities disproportionately impacted by COVID-19 were the same households and communities disproportionately affected by food insecurity. Data collected from program participants showed that 66% of the program participants reported moderate food insecurity, with 22% reporting severe food insecurity. 87% reported that it was somewhat hard, or very hard for their household to regularly eat healthy food. In total, the Grocery Voucher Program enrolled over 15,000 low-income households and distributed over $11 million in benefits across Los Angeles County from March to December of 2023. Implementing a large-scale grocery voucher program was new to DPH. Typically, basic needs programs such as food assistance are administered through public social services departments or through the charitable feeding system. The Los Angeles County Grocery Voucher Program is a model practice that local health departments can implement to quickly activate community partners to respond to a humanitarian crisis resulting from a public health emergency, especially if it is designed strategically and tailored to address food insecurity and hunger in vulnerable segments of the population. DPH was uniquely positioned to implement this type of program because of its ability to leverage long-standing relationships with partners to quickly respond to this need by distributing grocery vouchers equitably and efficiently.